the California Department of Public Health. He's currently State Environmental Epidemiologist and Science Advisor for the Environmental Health Investigations Branch at the California Department of Public Health. He was a World Health Organization advisor. He contributed to a systematic review of health indicators of climate change. He was a consultant on heat preparedness for the Public Health Foundation of India, and he serves on the Environment and Health Board for the American Meteorological Society. Has his master's in public health and a doctorate in epidemiology, both from the University of California, Berkeley, and he has over 16 years of experience working in environmental public health for the California Department of Public Health, and he has published extensively in the peer-reviewed literature. Please join me in welcoming Dr. Paul English.
Okay, thank you, Jerry, and thanks also to the Aquatic Academy for inviting me here tonight. It's a pleasure to be here. So I'm going to just, we're going to kind of switch gears a little bit now and talk about some things that a little bit closer to home in terms of your own health. And so you can see kind of the overview I'm going to be talking about, and just in my introduction, it was mentioned I'm an epidemiologist. Do people have heard of the study of epidemiology? When people talk to me at parties, they go, "Oh, you're a skin doctor, great." You know, so epidemiology is the study of the distribution of diseases, but getting involved in this this area of climate change, which is really new for the health field, for public health. You can see all the other disciplines you have to start thinking about, and and I don't, well, I know a little bit, otherwise I wouldn't have been invited here today. But you need to have air pollution experts. You need to have climatologists, meteorology specialists. I've been more, even within the health field in diseases, you usually specialize in a certain area. So I've done more chronic diseases, but this has implications for chronic diseases, but also infectious diseases. And all these other extreme weather events, oceanography with, I'm going to talk a little bit about harmful algae blooms, sea level rise, and then even moving into some of these other issues where you would want to have people interested in sociology and psychology and health communication. It's just such a broad field, and we all are trying now to communicate with each other on this. So tonight I'm going to then talk about what are the climate change events of most relevance to human health, and specifically with a focus on California, and then go through these different health outcomes of concern that you can see listed there, and then talk a little bit about who is really going to be affected by this, these climate change events, what type of people in our population, and then what are the issues as far as health, is how can we mitigate the effects of climate change, where California is a leader in that with our cap and trade regulations. And how are we going to adapt as populations to these changes? Because unfortunately, as you'll see in my talk, the cat is out of the bag. I mean, the emissions are up there, and they're going to be up in our environment for a long time before they start to decline. Even if we stopped doing all of our greenhouse gas emissions right now today, it's still a problem we're going to have to confront. So what are these events then that we're concerned about in California? So increasing temperatures is going to be the #1 issue that we're going to be worried about. Extreme storm events, people are getting real worried about those. Heavy precipitation events that could lead to flooding. The early snow melt, and that's really kind of related to the wildfire issue we just heard a great talk on. Drought conditions. Just these increasing carbon dioxide levels, and I'll give you the connection, and sea level rise. And this next slide then kind of shows the areas that are connected to each one of these two. So the increasing temperatures are going to result in more heat deaths and illnesses, and increased air pollution. The extreme storm events and heavy precipitation, we're going to have, as we saw with Hurricane Katrina, for example, higher deaths, displaced populations, and injuries. Not only the wildfires, the early snow melt leading to wildfires, but that's also going to relate to water quality issues for us in California. Because when the snow melts early, we don't have time to collect in the groundwater into the reservoirs. just all the water comes down from the mountains and just goes rushing. We lose a lot into the ocean. And then our water supplies are lower. And when you have lower water supplies, you have increasing risks of water contamination, both with chemical and infectious agents. Increasing carbon dioxide levels. Let's see, I skipped drought. Drought is going to be, again, water quality, and then the influence of the changing climate ecology on some of these disease vectors that we're concerned about. Some old ones we've had around and some newly emerging ones. Carbon dioxide levels, I'll be talking about how that's been shown in lab studies that it actually increases the growth of ragweed, increases how allergenic these plants are. And finally, the sea level rise issue, displacing infrastructure, and then also affecting water quality as the seawater intrusion into our groundwater sources near the coast will cause salinity issues. Oh, and I just wanted to add, please interrupt me anytime if you have questions or as we go through this. So let's talk about then issue number 1 first, heat waves and air pollution. What we know already, the last decade was the warmest decade on record globally. 2005, 2010, the hottest years on record. Now, one thing is weird about this, we're seeing hotter temperatures during the day, but one of the weird things is the nighttime temperatures, that is the minimum temperatures, those are even increasing more rapidly than the daytime temperatures. Can anyone have an idea of why, as far as human health implications, why you'd be concerned about nighttime temperatures, being warm at night? Anyone want to hazard a guess? What? Can't sleep? Yeah, basically, well, kind of, yeah, but it's just when it's cool at night, I think, and I know my father moved out to Southern California in the 40s, and he was like, oh, this is great, we have the hot days, but it cools off at night, but then, it just doesn't seem to be cooling off at night as much, and that's actually what's happening, is the night are getting warmer, and your body does not have time to recuperate and recover from that internal body heat you're generating if you can't cool off during the nighttime. And then you're faced with another horrible heat wave the next day.
That's true for the building you're in too.
Yeah, right. Yeah, open all the windows, let the cool breeze. Ozone levels. So ozone is going to increase because that ozone is a product of increased temperatures. In other words, these chemicals, these volatile organic compounds, they turn into ozone in the presence of sunlight and warmer temperatures. So we're expecting that ozone levels will increase, and that has implications. Ozone is now they're thinking it's a causal factor, exposure to ozone, a causal factor, work they've done out of USC in asthma. And it also does, already we knew it exacerbated asthma in asthmatics and caused other health problems. And then more wildfires, which we talked about. So, when you see the news about hurricanes or tornadoes, those all make the front page of the paper. And because, wow, they're so exciting and scary and stuff, but you never see on the front page of the paper, the big heat wave, look at this, well, what is the picture of the heat wave? Kind of just a house sitting there baking. But, the heat waves have been called the silent, invisible killers of silenced and invisible people, because they actually kill more people than all those other catastrophic events combined. Those people that are affected, you'll see, I'll tell you a bit about that. Those are individuals, they're vulnerable populations. There's a lot of elderly individuals living alone, isolated people. And there's not a lot of headlines about those type of people. So what we know, one thing about the heat waves, what they're predicting is increasing in severity and frequency, lasting longer and occurring earlier. Another question, why do you think heat waves occurring earlier would be bad for us? Any ideas as opposed to, let's say, if you had a big heat wave now? In fact, I think we had a heat alert a couple days ago for certain parts of the state. But if you have a lot of heat waves now happening in May as opposed to September, do you have any idea why that's worse to have a heat wave now? Basically, we can acclimatize during the summer. So if you're already, the body can acclimatize, and also there's different behaviors that people are starting to, you start wearing more shorts and lighter clothing, and your behavior is changing. And if all of a sudden it's like spring, and I've had a jacket on one day, and then the next day it was 100 degrees, what we've seen from research is in all those earlier heat waves, more people die and get heat illness during earlier heat waves. So this is not a good thing that's going to happen if we're going to get them earlier in the season. So you can see some of this research. They think that deaths will be likely to double by mid-century in like 21 U.S. cities. This is a map of the number of extremely hot seasons per decade. So you can see the darker colors are the number of more extreme hot seasons per decade. So you can see how, and these are kind of old data now. The story apparently is just getting worse because they got the Intergovernmental Panel on Climate Change, the IPCC. They're putting out new projections now. And these scenarios probably are not going to happen because we haven't been very good at reducing our greenhouse gas emissions. In fact, as you may have read, even during this worldwide recession, we've had the peak amount of global gas emissions, so we're not doing very well in that reduction, in the reduction category there. So let's talk about some great recent heat waves. There was a real great one in 1995 in Chicago. There were 700 deaths in 5 days. Most deaths were, it was a humid heat wave. Most deaths were elderly men. The Fort Black area was especially hit hard in Chicago. Then we had a European heat wave in 2003. This affected France, primarily France. You can see that's the map of the Russian one, but there was at least 40,000 people died during that heat wave, maybe up to 60,000 people in 2003 in France. Part of that was everyone, all the healthcare providers and stuff, they were out at the coast, you know, on vacation, and a lot of these deaths occurred in nursing homes, and they basically did not have enough staff to like grab people and put them in cold showers. That was the primary way of cooling people off. A lot of these facilities, if you ever, I mean, I've been in Paris when it's hot, like there's nobody who has air conditioning. You know, I don't know if that's changed since that heat wave in 2003. But it was a big, you know, political crisis also, why so many people died during that heat wave. We had a big one in North America and Europe in 2006. I'm going to talk about what happened here in California and that one in a little bit. And then this Moscow heat wave, 2010. So 55,000 people dead. And I don't know, John, if you studied that one at all, but that was partly a wildfire event. But they had these, it was a kind of a smoldering peat fires. They have these peat moss areas. I guess they use them for harvesting for energy, or they burn it or something. But those peat areas caught on fire. So quite a few of those deaths were a direct result of the heat, but also a good proportion of those were due to smoke inhalation from the fires. And they had just done, here's my next slide, because I talk about you know, what we learned from that. But in the Russian heat fire, you know, they just like laid off a whole bunch of firefighters. They had like no cooling centers. They had no preparedness plans for any of that. So all these social factors also work in on causing these huge catastrophes. France, I already mentioned that one. The Chicago one, again, a poor preparedness situation, but they have, in Chicago, they've done a great response to that, where now they have like everybody trained, like all the public employees to check on people, like even the guys that come by and empty your garbage. You know, they're going like, hey, where's Joe? Is he doing okay during the heat wave? So they actually like train the garbage guys, you know, to check on people. So they've really reduced illnesses and deaths due to heat in Chicago to a lot of these great programs they've instituted. Let's look at some of these new record highs in 2010. A lot of them, you know, Sudan, 121 degrees, Iraq, 125, Pakistan, 128. I mean, and even in Finland, I mean, Northern Europe, 99 degrees that hit a record. So all these areas being huge, over 100-degree temperatures, so. You know, this is part of the problem too, you know, like you'll have the politicians in Washington go, this is a cool summer, where's the global warming? Well, it's a worldwide phenomenon, it's a global thing. Did they even look at this chart? No. You know, they're like, in Washington, D.C., look at nothing, it's cool. There's no global climate change. So it's a global phenomenon, so you have to look at it from a global perspective. And this is, again, you know, this lower emission scenario probably isn't going to happen. So probably the new ones that they're releasing this one might be like a lower one or something. So, but these are the number of days, projected increase in number of days with the heat index. Heat index is both temperature and humidity. We haven't been concerned about it that much, but my understanding, talking to climatologists, a great heat wave we had in 2006, there was a particular humid air mass that came over. We don't usually get that much humidity, and that's also what, this increases in humidity is also what doesn't let us cool off at night also. So, so we might be starting to get worried about, they don't really even use heat index here in California that much. It's just like maximum temperature, what you look at. But look at this number of days increasing. So this is going up to, 90, 100 more days. That's like a third of the year. Heat index over 100 degrees. So here in these areas, that's Imperial Valley. That's not very fun out there if you've ever been out there. But we're looking at, Central Valley, like over a third of the year, you're going to be over 100. Yeah, definitely. Yeah, that could be another. Maybe you should get that in for the next talk. The impact on food and agriculture and with climate change. But those are pretty terrifying projections. So let me just update you on heat illness, because a lot of people don't really know the signs and symptoms of heat illness, and you need to know these, especially if you have elderly relatives, neighbors. So you first get a heat cramps, which is a real mild condition. Usually have under a fever, body temperature under 102 degrees. I was with some friends up in Oregon, and we were driving out the country, and she didn't have air conditioning in her car. And the first thing happened when we got out of the car, she just went over the side of the road and vomited. And everyone's like, oh, food poisoning stuff. No, that's a really common side. Vomiting is a common side of the next stage, heat exhaustion, where you really need to cool people down with rest. You don't need to necessarily go to the hospital at that point, as long as you can get somebody to cool off. We were down by a river, so we were able to cool her off. But heat stroke is, you don't want to get into that condition. That's when you're going to have a body temperature over 104 Fahrenheit. Even people that survive a heat stroke, in many cases they have long-term sequelae. That means they're going to continue to have problems throughout their life. So it's a very severe condition, so you need to get medical attention immediately. Question?
Get sunstroke and heat stroke, isn't it a lot easier to get hit again?
I don't know the answer to that. Have you heard something like that?
Experience.
Oh, okay. That's just from your personal thing? Yeah. Maybe it's affected your body's ability to
It's about 4 years.
weaken your body or your ability to fight it off or something. If you've had a severe assault. What I've been talking about so far has been classic heat stroke. There's also, so that's kind of how we think of people, people just sitting around unable to cool themselves off. But here in California, we're also worried about what's called exertional heat stroke. It's people that work in agriculture, farm workers, could be outdoor construction workers, athletes are another group, military is another group that you're concerned about exertional heat stroke. These are individuals that died in California. This is from my colleague in the occupational health branch. Really sad about Maria Isabel Jimenez. She was pregnant when she died. It's still a big issue, even though there's been new regulations for shade and hydration in agriculture in California. It's still a big problem for the state. And part of it is due, the laws are on the books, but how much enforcement really is there? We're going through budget cuts. We have to cut Cal OSHA inspections down. So this is, I bet you'll be seeing about this in the newspaper this summer again. So what happened in the 2006 heat wave? So we did some research. So we found that over 650 people died during that heat wave. And then look at all the people that went to ED, emergency department. Over 16,000 people, just during a 2-week period, 16,000 people went to emergency department, over 1,100 to the hospitals. So we found, when we looked at those individuals, children, elderly, poor, greatest risk, and we estimated, we did this study with the National Resource Defense Council, and they had economists look at this data, and they came up with an estimate over 133 million health-related costs. Agricultural losses were huge. You guys were talking about that earlier. You know, one of the big problems was the death of livestock and poultry. It was such a bad problem up in the northern part of the state is they could not get those carcasses rendered quickly enough. There was not enough rendering facilities to dispose of their carcasses, and they were starting to get worried about a water contamination issue. There were just, you know, dead animals everywhere. You just couldn't get rid of them. You have to get rid of them quickly. So here's a map of the coroner heat deaths, and so we get additional information on what are these are deaths like when you say, oh, we haven't heard from Uncle Fred. You call the police and they go and look in these individuals' houses, and you can see the distribution. Larger red dots, or more people died in those areas. So you can see it was concentrated, mostly Central Valley, and then some of the southern areas, the southeastern desert areas of the state. And with this there was about, this shows you kind of this, we call this kind of like an epidemic curve. And the one thing to notice in here, these are the peaks of deaths. And you can see this is the temperature. And see how the deaths peak a little bit after the maximum temperature. So this is kind of a typical exposure mortality curve, in that there's like a 1 or 2 day lag, and then you'll see the peak in deaths.
Why is that?
Because really the effects are kind of cumulative, and those are also, those are days, multiple days of high temperature, so you can kind of withstand maybe 1 day, but then once you're getting repeated exposure to those high temperatures, that's when you're starting to see more illnesses and death. So you're kind of able to withstand it right in the beginning, but there's kind of a little bit of a lag, a 1 or 2 day lag that we can see in the data. So we were able to review these coroner notes then. These weren't all the people that died, because people died in hospitals and stuff, but these are people that died at homes. And these coroners, a lot of them are like retired police and stuff that do this. And it's basically like a rule out diagnosis. So they have to, they go in, we got to rule out foul play, they rule out suicide, and they have certain different criteria. They have a minimum body temperature criteria. They also have an indoor heat temperature. But look at that data. Somebody had 140 degrees inside their house when they found the body. I mean, those are huge, huge temperatures. Number of people had functional air conditioning, but they wouldn't turn it on. They didn't want to spend the money. So that's a real big concern, for us is, and utilities not shutting people's power off during heat waves, because we sent them a notice 2 weeks ago, just bad timing. So half of these people that died then lived alone. And of those people, only about, only a little bit more than half had a social contact that checked on them. And then those that did have people checking on them, only, 19% checked on them, within 24 hours of death. So that's another area we really need to work in, is making sure people have social contacts, and they're going to check on them, more frequently than that, every day. So these were isolated people living in poor areas. Of course, more elderly, and they also had other chronic diseases, often diabetics, obesity. We didn't see, in this series, we didn't see children being affected, but when we went and looked at all the death certificate data, that's when we started seeing children also in this series going into the emergency department and the hospital. Okay, so we'll move on to more happier subjects. It's going to be a real up talk, I can see. But besides heat waves, let's talk about some other extreme weather events. 90% likelihood this intergovernmental, first when I saw it, I thought it was interplanetary. Couldn't you imagine like all the different countries of all these different planets doing, we're worried about climate change, we're doing the Interplanetary Council, intergovernmental panel on climate change. So 90% likelihood extreme events become more frequent. Now, when you think of Katrina, first of all, the direct impacts, 971 deaths. These are just like direct drowning. You got injured, whacked on the head, you're dead, trauma, heart attacks. Those were leading causes of death. We call those direct impacts. But then there was also indirect impacts, and that's these illnesses. These are kind of more longer-term indirect impacts, mental health issues. Can you imagine what's in those houses now? You go in there, now the water's all gone. You open up the door, the smell of mold will just like knock you down. I mean, it's all throughout. You have to rip it all down to the studs. They try to like, the insurance company says, just put some paint on it. No, don't ever do that. I mean, the mold is, once it's in there, it's going to make people get really sick from mold exposures. You're going to have, right in these events, and these were used to be like international, concerns, in developing countries. And now here we're going to be dealing with this now. First of all, they had a lot of these chemical storage places and stuff, gasoline stations, other places. They get all flooded, and all that stuff comes into the water. So you have a lot of toxic compounds in that water. And then, what do you think happens to like waste? Toilets and the waste, all that stuff gets in there, and that's when you start getting, cholera risk. And people start getting cholera, down the road after that. So and then things like, in the wintertime when you have these events, people start powering up generators in their garages.
Yeah.
Carbon monoxide poisonings go up. So people die from carbon monoxide exposure. So a lot of, when you really think about it, and people get displaced, everyone had to go, after Katrina, where did they go to the big Coliseum in Texas? And there's a lot of mental health issues. You can't get your medications, you're not getting care for, these are old people with needing care. So there's a lot of other health issues related with displacement. U.S. has some of the most significant tornado disasters, floods being the most common disaster. You guys have heard about wildfires and drought. Drought we'll talk about in a minute. So this is the idea, again, I'm not a climatologist, but they're saying, somehow and I don't know if you know anything about this, John. Please feel to jump in here, but so apparently the higher temperatures in the ocean, it causes some changes, or can cause some changes in parts of the world in air circulation that controls rainfall, can reduce rainfall. And then we talked about the impact on wildfires when the soil is dry, you're going to have more wildfires. Now I'm going to talk about infectious disease. And then in parts of the country we're starting to have actual wars over desertification. So water wars, where parts of the world are drying up, and we're going to see more armed conflicts related to desertification, which could be related to climate change. We have seen increases in heavy precipitation over the last 20 years. The water is, what do you think of happening when the heat on the ocean, that water is going, it's like a closed system, right? The water goes up and it has to come out again sometime, and so we're going to be seeing some heavier rain events. There is some evidence too about hurricanes increasing intensity. This is kind of some mixed climate evidence, as far as I can tell, about the intensity of hurricanes, but we're going to be hearing more about that. Here they have found a relationship between a 1 degree increase in surface temperatures in Atlantic, tropical storms increasing up to 18% in rainfall, wind speeds decreasing. Here we had a hurricane, just looking at the destruction of that, Hurricane Mitch in Central America, 11,000 dying from the result of that. This is a chart showing you, it doesn't look like a real clear trend, but you see the big 2005 banner year with Hurricane, Katrina, Dennis, Rita, Wilma, 2,000 deaths. But still remember, look at these numbers, they're so much lower than what I was showing you at the beginning of the talk. But again, this is what you're going to be seeing in the paper and a lot of the media coverage. Talk about wildfires. We're talking about increasing frequency, duration. We've already talked about that. John didn't really talk about air quality that much, but you're going to see more particulate matter, more carbon dioxide released, and then, you know what, that's like a vicious cycle because the fires burn, we're releasing more carbon up, that increases the propensity for more wildfires, and so, you know, it's like you're getting into this vicious cycle. So that's why it's a really big concern. He probably showed you a better chart than this, but again, looks like there's probably some linear trend with in California with the surface area being burned. Let's talk now a little bit about environmental infectious diseases. And I picked out 3 conditions. One is coccidioidomycosis, or valley fever, you may have heard of that. West Nile virus, and dengue fever. So West Nile and dengue are transmitted by mosquito bites. Valley fever is a fungi. It's endemic to the San Joaquin Valley in the southwest U.S., so it's in the soil. Fungus is in the soil. But look at, I'm sorry?
We have dengue fever.
We'll talk about that next. But so here you can see the number of cases. They're more tripled from 2000. Still, you know, pretty rare, 8 per 100,000. But what you have, you know, they notice this like a lot of people like building prisons out in the Central Valley. They disturb the dust. We're getting that's where you're getting exposed to valley fever. It can be fairly serious condition. Respiratory system is affected. And they're thinking there's more frequent dust storms now. And I guess we have to find out what the climate change relationship is, but more dust storms are going to bring up this fungus and get people more exposed. I'm sorry?
Bad agricultural practices.
Maybe, yeah, that could be part of it too. West Nile virus, the virus is transmitted by mosquitoes. It's also, at first it comes in birds, and then the birds die, and mosquitoes feed on the birds, and then the birds bite us. Don't really see a real trend in fatal human cases in California, but there has been at least one study showing a correlation between increasing temperatures and rainfall levels and outbreaks in the U.S. So there is active research in this area looking at the connection between West Nile virus and climate changes. Yeah.
Because in my imagination, are the crows a lot bigger now?
I know, they're looking scary. I mean, maybe they like it.
Survive.
Yeah, the ones that, if it doesn't kill you, it makes you stronger. Okay, so dengue hemorrhagic fever. So this is now endemic in South Florida. You need this special Aedes albopictus mosquito, or they call it the tiger mosquito. So they just found this now. They found it in San Gabriel Valley in Los Angeles County. They went in there and tried to kill them all. But that's not very reassuring. What's that?
The tiger mosquito.
Tiger mosquito. And not only can it transmit dengue, hemorrhagic fever, yellow fever, and chikungunya, which is another viral disease that we've seen overseas that could possibly be transmitted here also. You know, you get people that are infected from overseas, and then they get bitten here, and then it can. Well, most of these cases we've seen have been people that come from overseas that have been infected there. But now we can have the potential to have these things here, as you can see. Southern Florida, especially concerned around the U.S.-Mexico border, the conditions are ripe for dengue fever outbreaks. Okay, respiratory health issues related to increased pollens. So I mentioned lab studies showing that increased carbon dioxide related to, you know, making the ragweed grow better, and the allergenicity potential of the ragweed is risen. We've already seen ragweed season being longer now, and does anyone ever go to Quest Diagnostics to get your blood? Yeah. So they did a study because they have all that data right from the lab, and they have, because people do those allergy tests, and they looked at a whole bunch of different allergens, and look at that, it was like sensitization to ragweed over a 4-year study. It went up like 15%, mold 12%, and the other allergens, you know, compared to 5.8% for the other allergens. So, and they made a big deal about climate change in that report. I thought that was pretty interesting. I don't know, you know, we don't really have been studying this issue at all because we don't have very good pollen monitors. It's kind of like a volunteer system that this National Allergy Bureau does. And some of the allergen specialist people, they'll have them in their offices so they can tell their, you know, patients what the pollen levels and stuff. But we have a very poor pollen monitoring system, which is going to prevent us from really making advances in research in this area. Okay, sea level rise and algae blooms. So we talked about destruction. This would probably be something you might be worried about here. Destruction of infrastructure, population displacement. So not only does the water come up, but it's really concerned about the wintertime because you're going to have higher storm surges now. If it just goes up a foot or more, then the water's going to start coming over. And that was a big concern in Japan during the tsunami, because where that nuclear plant was, they had built a fence like for the maximum, wave event from the tsunami that they'd estimated. But sea level rise is moving that up there, and that wave just went like right over that little fence barrier they had there. And of course, they had their generator right there. So instead of like Mart Inland, so that was like their generator to keep the power on at the power plant or the backup generator thing. And so that's why you had that meltdown at that plant in Japan. And then I already mentioned the water salinity issues. And this is, you can start mapping some of this stuff. They have, this is from U.S. Geological Survey. And then you can link this with census data. And so we, put an estimate of how many, what population by county would be potentially affected from sea level rise problems. So that comes up pretty nice here. So the darker colors, larger numbers of population. Okay, harmful algae blooms. We're seeing a worldwide increase in both in the oceans and in freshwater. And these blue-green algae, sometimes you call them red tides, they're not all toxic, but we're seeing they're greater in duration and intensity. This is where we get these shellfish contaminations and poisonings, this paralytic shellfish poisoning called PSP. And these toxins that are produced by these blooms, these cyanobacterial blooms, they produce nerve and liver toxins. And you can get exposed then from contaminated shellfish and get poisoned. Or you could get affected by contaminated drinking water or exposure in recreational waters. A lot of recreational waters in California now, we're getting more algae outbreaks, and people still want to go water skiing and stuff, and they're getting exposed to this. What's really interesting is there's a hypothesis out there that this one of these enzymes that's produced by these blue-green algae may be related to Lou Gehrig's disease or ALS. And this is a very fatal disease, usually die in a year. There's this enzyme called BMAA that's produced by these blooms. And when they found a big outbreak of ALS, similar ALS disease in Guam, they found this was related to some indigenous populations eating these flying bats. They would eat them whole. They'd like dip them in coconut oil and fry them up. And when they found this BMAA enzyme, and all those people that were dying of Lou Gehrig's disease, a similar condition in Guam, and when they did autopsies and looked at the brains of deceased ALS people, both in Guam and in the U.S. and other places, they find high concentrations of the same compound. So this could be another, they're starting to do epi studies looking at, did people that are contacting ALS, did they live or near or have some contact with recreational waters that had blue-green algae blooms. So we're going to wrap it down, but talk about a little bit more about population vulnerabilities. I guess I should have shown this to you earlier, but look, we got a pretty bad West Nile virus distribution here. The Lyme disease is another condition that they talk about related to climate change, and that's like in the northeastern part of the U.S., and that's been a very well-studied condition. Location of extreme heat events. So it's kind of dated right now. But we can start looking at other things like percentage of elderly population where they're living. The two things you want to look at is, of course, you can rank areas by exposure, but then what's your capacity to adapt? If you have low adaptive capacity, you still might have low exposure, but you probably still have moderate risk. So you can look at vulnerability by at three pieces. One is, the exposure, like whether it's heat or extreme weather events or whatever you're talking about. And then what is the sensitivity of the population. So if you're looking at a population that has diabetes, tuberculosis, overweight, they're going to be more susceptible to the condition. And then what is the adaptive capacity you have? Both the resources in your community, your personal behaviors, and then, but also we need a response capacity in your community too. So if you're like cutting all your services, there's no emergency preparedness, there's no response capability, then you're losing part of your adaptive capacity. What are some of these community resilience factors? We're looking at stuff like parks and open space nearby, talk about public health infrastructure, and even things like unemployment, violence, and crime rates can influence risk. For example, areas that have a lot of crime, what happens during a heat wave? Nobody wants to open their window, right? Or they have bars on their windows or whatever. But so they won't cool their house off because, are you kidding? Someone's going to come in and rob me. So it really is another issue to think about. Things like food security, availability of cooling centers. There's been work done. This is work that was published in this journal, Environmental Health Perspectives, and they can make indices about your heat vulnerability based on characteristics like demographics, open space, land cover, and then even looking at other conditions like what's the rate of diabetes and what's your ability to have air conditioning in your house. So we did a project here. I'm going to show you some results from LA County. So we looked at central air conditioning ownership, land cover, or you can look from satellite imagery, you can get both tree canopy and then impervious surfaces. That's basically how much concrete is in the area. Transit is important because, who were the people that died in New Orleans? Was it people that were rich and could hop in their cars and get out of there really fast? Or people that didn't have cars and the people that didn't have cars. Those are the people that died. Wildfire risk, flood risk. And then we mapped this down at the census tract level, which is pretty cool because normally we've been just looking at things at a more coarse level, like the county level. And then maybe, are you guys familiar with LA County? We're like in orange here, right?
No, we're in LA.
Oh, we're in LA? Hey, we're going to be on here. Okay. So like here's, where are we? Oh, we're at the very corner here. All right, so, because I haven't had an opportunity to show these maps to many people, so I don't know if they really make sense. But, so we got this data from the Energy Commission. And I thought these were kind of, okay, so high risk, this means these people don't have air conditioning. People also right near the coast probably don't, even if they're rich, they probably don't have air conditioning. But are these these are generally, I thought, some fairly poor areas, it looked like, that were showing up. I don't know, do you know enough about Long Beach? I have no idea why this variability would be like that, but you need to zoom in and maybe look at landmarks a little bit more, roadways. Risk from sea level rise, nothing unusual there. This shows the drainage basin, I guess, of the LA River when you put these FEMA flood map risks in here. And does the river drain like that down here? Yeah, because it ends up right here, right? Because that's what you just showed me, Jerry, out there. So those are the high risk areas for flooding. And then this wildlife urban interface that John was talking about earlier, our forestry agency gives us this data. And what is this? Is this Palo Alto Estates or Palos Verdes Estates? Is there like some forest there? Okay. Yeah, so I guess that looks like that makes sense. I don't know what these little areas are here. I don't know what these little ones are. And then this one's kind of the opposite of the tree canopy one, but that just shows you where the cement is. So the red is a bunch of cement. There's this urban heat island effect where the cities don't cool off as quickly as if you went out of the cities because of all that concrete keeps radiating out the heat all night long. And so that's kind of the opposite, except this gives you more variability in the concrete. This just shows you where the trees are. So then we average all those scores together and make a new scale. So 5 is the this is the high risk areas when you look at all those factors. Some people didn't like this because they just said, oh, well, now you're going to give all the rich people here a lot of money. But when we looked at the data, we found out there were a lot of elderly people living alone looking at the census data, and also was bad transit up here because they all have their own rich cars. But then, yeah, so, you know, you gotta do like some ground truthing on this. Sometimes it doesn't really make sense, because you pick the variables, but unless you really know the area. But look at this interesting, well, here's a zoom of it, if you want to look in a zoom.
Long Beach is like way over there.
I'm sorry?
I was just saying Long Beach.
Oh, Long Beach isn't in that thing. Oh, yeah. Oh, yeah, okay. But it's cut off. Yeah. So you can see the variability we had. And then these are the interesting analysis. So then we went back and then we characterized these census tracts by race, ethnicity, and income. So remember the 5 was the high risk, right? Low. And then look at African American, Latino, white. So low risk. And then, so we found, and you combine these 2 categories here, half of African Americans, 36% of Latinos reside in these 2 highest risk categories compared to only 30% of whites are in those risk categories. Yeah.
Is that using current census data or the previous?
2000.
Okay.
Because a lot of our data was closer to 2000, so mine would be good. Yeah, it'd be interesting to update this when we have a bunch of other new data. And then also look at that. You know, we call this a dose response in science, but you usually don't see nice things like this. But yeah, if you live in those areas, low climate change risk, you're doing okay. So the bottom line is this. Now this is showing some, some facts, some evidence that, that minorities and lower income people are likely to be most affected by climate change risk, and that's shown right here in Los Angeles County and not somewhere overseas in Africa or whatever. So some issues about adaptation, just to conclude, so we have a few minutes for questions if you have any more. But even if we stop the greenhouse gas emissions now, there's enough accumulated that we're going to be seeing effects. So we need to be working on increasing community resilience, more outreach. We have some surveillance capabilities in the state, but as you know, with the budget being cut all the time, we're decreasing our capability to keep doing this. There's, of course, personal adaptation you can do. Avoiding exposure, hydration is important. I'm thirsty. Getting hydrated. And then the acclimatization issue. It's kind of really unknown, like how much we really are going to acclimatize. Because people might just say, well, don't worry. It's going to be 100 degrees 1/3 of the year. You'll like it. You'll get used to it. And these things are starting to really be effective, or being actually visible in certain communities more than others. And the Arctic is one area where it's really, we're really seeing dramatic climate shifts. And I just want to show these issues. The indigenous peoples there for hundreds of years, maybe thousands of years, they would have these ice cellars, right? They're frozen in the permafrost, and they catch whales, and they cut them up. And you put them, you have this total freezer thing happening all the time. Well, now the permafrost is all, here's one where the permafrost is melted. So all their whale meat now is all rotten, and this is part of their cultural traditions. And they, this shows how climate change is really affecting cultures and ways of life going back hundreds or thousands of years right now. And that's going to have really significant impacts. We talked about urban heat island mitigation. People are into cool roofs, urban forestry, reduction of all these cumulative stressors in certain areas, and developing these heat wave warning systems and all these other issues I think I've already talked about. So that's it. And the CHTP.org is where there's a lot of information, more information about what we're doing in climate change. Thank you very much.
Well, thank you. We have time for some questions.